Well, thanks for taking the time. I know it's a busy show.
Absolutely. Delighted.
Da Vinci 5 rollout seemed to have gone as clean as a rollout has ever gone. Tell me about that.
We hope so, yeah. So we were very conscious about how we had set the bar with DaVinci Xi in terms of our quality, our reliability. And so we were very conscious about that. And we took the time to develop a product to meet that same bar. And so far it's been going great.
It's always amazed me on how Intuitive has this developed this great playbook of taking incredibly complex technologies, yet never overwhelms the surgeon or overwhelms the care team.
That is the whole point. The whole philosophy is that this is a tool for the surgeon. And so it is really in service of the surgeon and the care team. Our goal is to make care easier and a better experience for the care team. So that is the goal.
And we've started with somewhat of a limited rollout, right? What does that look like? What can you share through the balance of 2024 and into 2025?
Yeah, what I can share is that, like I said, we have set a really high bar in terms of quality and reliability. On XI, uptime is 99% uptime. Our convert and abort, or conversions and abortions, our abort rate, which is, when people start a procedure, but for some reason either have to convert to lap or open, or, completely stop doing the procedure, it's 0.1%, Joe. 0.1%. So that is really a high bar. And so there's a number of reasons we did the slow roll with DaVinci 5. And one is to make sure that we maintain that quality and reliability for our customers. And also, we launched two really established robotics programs with both novice and expert surgeons, but with established robotic programs, so that we can take the time to understand the feedback and validate the hypotheses that we had around the value that DaVinci 5 is bringing, so that we can gather that feedback. And then also make sure that all our ecosystem is scalable. What we do is more than just a robot. It's the entire ecosystem, the services, the training. And so making sure that all of that is scalable is also part of our goal.
And you've built a tremendous machine. To your point, the robot is more than the arms, right? And it's an entire ecosystem. With the DaVinci 5, we're looking at the tower here. That really ruffled a bunch of feathers in the marketplace and went from just being a tower on a robot to maybe even more in the ecosystem.
Yeah, let me tell you about our philosophy there. Our goal is to improve the care team experience. And so part of that, you hear some of the challenges that the hospitals are facing, and it's workforce challenges. So the more autonomy you can give the surgeon so that they are more in control of changing settings, reproducible experience that they can have. So we've incorporated elements of the OR into the tower to add that autonomy for the surgeon and give the surgeon the ability to make the changes that they need to without relying on the workforce.
So DaVinci 5 has gotten a lot of headlines, but I also know the SP has had a really nice launch in Europe as well. And how's that been?
So, as you know, DaVinci SP is our single port robot. It has been designed specifically for narrow access and alternative access, and it has been great. In the EU, we now have CE mark for a broad set of indications, whereas in the US, we're only cleared for urology and transoral surgery. But in the EU, we're cleared for general surgery, GYN, colorectal, transoral, urology, thoracic, and nipple-sparing mastectomy. And so far, it's been great. We're still early. We're about a couple of quarters into the launch, but hearing a lot of great things.
Outstanding. Well, I want to take you over to our studio on the floor over here, sit down, and ask you a couple more if you got it.
Sounds good. Let's do it.
Let's take a walk. So thanks for spending the time out on the floor. I mean, we had to throw elbows to get around. You had everybody around the booth there so far at SRS 2024. What do you think it is that has the entire industry, and I mean that, have such confidence in the products that come out from Intuitive?
Um, Really, Joe, I think it's about our consistency in delivering to our commitments and a long history of that. 29 years. Da Vinci 5 is the fifth generation of our multi-port robot that we're commercializing. And we've also done, Da Vinci SP, and we've done Ion in the same time frame. And repeatedly, our products demonstrate high quality, high reliability, and really demonstrate that we meet the user needs. And I think that's what we're known for.
One of the things that the markets do is they vote with their hands, the surgeons, and they also vote with their thoughts on where is that company going in the future. And I did a little homework before our session here, and I want to talk about the hypothesis on that platform value that you just shared, Ion, Da Vinci SP, Da Vinci 5. So you've got Intuitive currently holds the largest market cap in med device companies. Although it's only 7 billion in revenue, it's over 150 billion market cap. Medtronic, 32 billion in revenue, only 104 billion market cap. And I can go on. Stryker, 131, 18 billion. That's an incredible amount of confidence in the future of the Intuitive mindset of digital surgery. So where do you hope to see us grow to? Where do you hope to see Intuitive penetrate markets that it might not even be playing in now?
Um, that's a really good question, Joe. And I think it again goes back to the value that we deliver. We really don't think of ourselves as a robot company. We think of ourselves as a company that provides the whole ecosystem of solutions for our customers. And I think that's recognized. We deliver on the commitments, and we do it again and again. So I think that is something that's recognized. And then if you sort of look at the bigger picture of soft tissue surgery, there's still a lot of opportunity to be had there. We've done about 2.5 million procedures, and with the products and the indications that we have cleared and what's in front of us, that opportunity is 7 million procedures per year. And beyond that, we have to do more work to get there. And I think the market is recognizing that.
Dave Rosa had a great conversation yesterday. It was really fun. And one of the things he pointed out that's the truth is one of the reasons why Intuitive does so well in this market is it retains its people.
Mm-hmm.
And so let's slide to that for a second. When you go down the roster at Intuitive, we've obviously had Gary hand over part of the mantle to Dave recently. Gary's still involved, I'm sure. But when you start to go through the team at Intuitive, the retention is far and away higher than any other med tech company ever. Why is that?
You're absolutely right. I have been at Intuitive for 11 and a half years, and I often ask myself, why am I here so long? And I hope to continue to be here for many more years. And it's really culture, and it's so hard to define what culture is, but what I can say that it trickles down all the way from the top, and it's something that our leadership team lives and breathes every day. When I think about Gary, Dave, and the leadership team and the high tenure people that are there at Intuitive, there's so much depth of knowledge on our business and our products. It's a complex business. If you think about, we're a robot company. We have everything from the capital system to single-use instruments to multi-use instruments and everything in between. It's a complex business, and the depth of knowledge of the leadership team is just outstanding. I've held multiple functional leadership roles in my tenure, and you would think that when you've had a functional role, for a few years, that you know everything there is to know about that vertical, and then you go and have a conversation with Gary or with Dave, and you're like, man, how can they know more about my vertical than I do? So it's always a humbling experience. And I think that is a huge part of it, is because there's, we don't do much in educating the executives. They're living it, they're breathing it, and it says a lot about the company.
Well, we're going to be watching Da Vinci 5 closely as it continues to set the bar for those that follow. We're at a surgical robotics show here with, I think, 40 platforms. It's fun to watch everybody go, yeah, but we're not going to compete with Intuitive. That's got to be a fun place to be, and an honorable place to be. I totally appreciate your time, your team's time for arranging this, and I look forward to Da Vinci 5 and the SP rollout over the next year or two.
Great, same here. Thank you for having me.
Thanks so much. I'm Joe Mullings from SRS 2024. Be well.